Hello, my name is Adelie Corti, and this presentation for my research is about sleep apnea, causes, symptoms, and treatment to understand the impact of sleep disorders in our health. What is sleep apnea? It's the absence of inspiratory airflow for at least 10 seconds or longer during sleep. Sleep apnea pauses our breathing 30 or more times during sleep. The most common sleep disorders are narcolepsy, hypersomnia, sleep talking, sleepwalking, and bedwetting. The importance to understand sleep apnea is because the potential consequences in our health. Untreated sleep apnea can lead in atrial fibrillation, cardiac arousal, morbidity of hypertension, coronary heart disease, arrhythmia, and heart failure and stroke. Prevalence of sleep apnea is estimated to be between 2 to 6% in adults, being more common in the middle age between 40 and 65 years. Men are 3 times more likely to have sleep apnea than women. There are 3 types of sleep apnea: obstructive, central, and complex. Obstructive is the most common form and is affected between 2% to 14% of the population. Central sleep apnea is the less common. It's a cessation in the airflow without respiratory effort. And the complex is a combination of obstructive and central. Causes and risk factors: physical obstruction, craniofacial structures, enlarged tonsils, and adenoids. And genetic factors, family history. Lifestyle factors, obesity being the most significant risk because the fatty tissue around the neck. The smoking, it can produce inflammation or liquid retention. Alcohol consumption, it can relax the throat and reducing the breathing. Symptoms of sleep apnea. The most common symptoms are loud snoring, breathing cessation issues, gasping for air during sleep, dry mouth and throat. Daytime symptoms: excessive daytime sleepiness, difficulty concentrating, morning headache that can affect our life because we're gonna feel tired, we're gonna feel depression and anxiety, and it affects the memory and concentration. Overnight consequences of sleep apnea. It can affect the arterial blood, can produce hypoxemia, excessive arousal, decrease parasympathetic and increase the sympathetic activity, and large negativity intrathoracic pressure swing. The diagnosis of sleep apnea is the medical history and physical examination. Is when you assess the patient, the risk, the factor, and check the vital signs, and do the physical examination. And a sleep study is a test called polysomnography. Is to measure level of oxygen, carbon dioxide, brain, and home sleep apnea testing. This one is less accurate than polysomnography. Now we have a picture about what is the polysomnography looks like. And this is an essential test to confirm sleep apnea. And it checks breathing patterns, oxygen levels, and brain activity. There is a test when you're assessing the patient. Is this called Stop Band? It's a questionnaire, a validated screen tool to diagnose this disease. Treatment option: lifestyle modification. Like the people, it's recommended that the people do exercise, have a good diet to weight loss. And positional therapy is recommended lateral instead of supine because it can help the airway being open and not obstructed. Medical treatments, continuous positive airway, CPAP, oral appliance, and even surgery. There is a picture that it can show the medical treatments. As I was saying, the CPAP is the first line treatment and it has a successful rate about 75%. This is a picture of how the mask look like. And the oral appliance is for mild diagnosis, and it can help in the oral appliance for mandibular advancement device, tone retaining device. That's the two main appliance therapies. And the surgery, if the other treatment don't work as required, there's another option. There is a surgery. There is a different procedures that the people can have to improve the breathing, to improve the airway, and to remove any obstruction. Impact of untreated sleep apnea, cardiovascular complications, cognitive and mental issues, and quality of life. There is a picture that illustrates how the obesity can produce a sleep apnea, and sleep apnea can lead to a heart disease, hypertension, atrial fibrillation, and even any state of the cardiovascular disease. And this is a reference for my research. Thank you for your attention.